Hi, Ruben here and welcome to Anatomy Movement, where anatomy becomes funatomy. We have summarized and detailed notes, acronyms, HD images to build your photographic memory, X-rays images, tabled notes and questions and answers at the end of each video to help you remember all that we have learned. Without further ado, let's dive into today's topic. Bones of the upper limb. The bones of the upper limb include the scapula, the clavicle, the humerus, the ulna, the radius and the bones of the hand. Let us have a quick look at each of them. The scapula. The scapula is also known as the shoulder blade. It articulates with the humerus at the glenohumeral joint, and with the clavicle at the acromioclavicular joint. In doing so, the scapula connects the upper limb to the trunk. The costal anterior surface of the scapula faces the ribcage. It contains a large concave depression over most of its surface, known as the subscapular fossa. The subscapularis originates from this fossa. Originating from the superolateral surface of the costal scapula is the coracoid process. It is a hook-like projection, which lies just underneath the clavicle. Three muscles attach to the coracoid process: the pectoralis minor, coracobrachialis, and the short head of the biceps brachii. The lateral surface of the scapula faces the humerus. It is the site of the glenohumeral joint, and of various muscle attachments. Its important bony landmarks include glenoid fossa, a shallow cavity, located superiorly on the lateral border. It articulates with the head of the humerus to form the glenohumeral joint. Supraglenoid tubercle, or roughening immediately superior to the glenoid fossa. The place of attachment of the long head of the biceps brachii. Infraglenoid tubercle, or roughening immediately inferior to the glenoid fossa. The place of attachment of the long head of the triceps brachii. The posterior surface of the scapula faces outwards. It is a site of origin for the majority of the rotator cuff muscles of the shoulder. It is marked by spine, the most prominent feature of the posterior scapula. It runs transversely across the scapula, dividing the surface into two. Acromion, projection of the spine that arches over the glenohumeral joint and articulates with the clavicle at the acromioclavicular joint. Infraspinous fossa, the area below the spine of the scapula. It displays a convex shape. The infraspinatus muscle originates from this area. Supraspinous fossa, the area above the spine of the scapula. It is much smaller than the infraspinous fossa, and is more convex in shape. The supraspinatus muscle originates from this area. The scapula has two main articulations. Glenohumeral joint, between the glenoid fossa of the scapula and the head of the humerus. Acromioclavicular joint, between the acromion of the scapula and the clavicle. Quiz. What name is given to the concave depression on the costal surface of the scapula? Subscapular fossa, infrascapular fossa, suprascapular fossa, glenoid fossa. The correct answer is subscapular fossa. The clavicle. The clavicle is a slender bone with an S shape. Facing forward, the medial aspect is convex, and the lateral aspect concave. It can be divided into a sternal end, a shaft and an acromial end. The clavicle has three main functions. Attaches the upper limb to the trunk as part of the shoulder girdle. Protects the underlying neurovascular structures supplying the upper limb. Transmits force from the upper limb to the axial skeleton. Sternal or medial end. The sternal end contains a large facet, for articulation with the manubrium of the sternum at the sternoclavicular joint. The inferior surface of the sternal end is marked by a rough oval depression for the costoclavicular ligament, a ligament of the SC joint. Shaft. The shaft of the clavicle acts a point of origin and attachment for several muscles: deltoid, trapezius, subclavius, pectoralis major, sternocleidomastoid and sternohyoid. Acromial or lateral end. The acromial end houses a small facet for articulation with the acromion of the scapula at the acromioclavicular joint. It also serves as an attachment point for two ligaments. Conoid tubercle, attachment point of the conoid ligament, the medial part of the coracoclavicular ligament. Trapezoid line, attachment point of the trapezoid ligament, the lateral part of the coracoclavicular ligament. The coracoclavicular ligament is a very strong structure, effectively suspending the weight of the upper limb from the clavicle. A 22-year-old man sustains a displaced clavicular fracture after falling off his bicycle. He undergoes an open reduction and internal fixation of the fracture. Which of the following nerves is most at risk of iatrogenic damage during this procedure? Axillary, suprascapular, supraclavicular, accessory. The correct answer is supraclavicular. The humerus. The humerus is a long bone of the upper limb, which extends from the shoulder to the elbow. The proximal aspect of the humerus articulates with the glenoid fossa of the scapula, forming the glenohumeral joint. Distally, at the elbow joint, the humerus articulates with the head of the radius and trochlear notch of the ulna. The proximal humerus is marked by a head, anatomical neck, surgical neck, greater and lesser tuberosity and intertubercular sulcus. The greater tuberosity is located laterally on the humerus and has anterior and posterior surfaces. It serves as an attachment site for three of the rotator cuff muscles, supraspinatus, infraspinatus and teres minor. The lesser tuberosity is much smaller, and more medially located on the bone. It only has an anterior surface. It provides attachment for the last rotator cuff muscle, the subscapularis. Separating the two tuberosities is a deep groove, known as the intertubercular sulcus. The tendon of the long head of the biceps brachii emerges from the shoulder joint and runs through this groove. Pectoralis major, teres major and latissimus dorsi insert on the lips of the intertubercular sulcus. On the lateral side of the humeral shaft is a roughened surface where the deltoid muscle attaches. This is known as the deltoid tuberosity. The radial or spiral groove is a shallow depression that runs diagonally down the posterior surface of the humerus, parallel to the deltoid tuberosity. The radial nerve and profunda brachii artery lie in this groove. The following muscles attach to the humerus along its shaft. Anteriorly, coracobrachialis, deltoid, brachialis, brachioradialis. Posteriorly, medial and lateral heads of the triceps. The spiral groove demarcates their respective origins. Distally, the trochlea is located medially, and extends onto the posterior aspect of the bone. Lateral to the trochlea is the capitulum, which articulates with the radius. Also located on the distal portion of the humerus are three depressions, known as the coronoid, radial and olecranon fossae. They accommodate the forearm bones during flexion or extension at the elbow. Articulations. The proximal region of the humerus articulates with the glenoid fossa of the scapula to form the glenohumeral joint, shoulder joint. Distally, at the elbow joint, the capitulum of the humerus articulates with the head of the radius and the trochlea of the humerus articulates with the trochlear notch of the ulna. Quiz. Which injury to the humerus is most likely to cause the clinical sign shown? Anatomical neck fracture, surgical neck fracture, mid-shaft fracture, epicondylar fracture. The correct answer is mid-shaft fracture. The ulna. The ulna is a long bone in the forearm. It lies medially and parallel to the radius, the second of the forearm bones. The ulna acts as the stabilizing bone, with the radius pivoting to produce movement. Proximally, the ulna articulates with the humerus at the elbow joint. Distally, the ulna articulates with the radius, forming the distal radio-ulnar joint. The proximal end of the ulna articulates with the trochlea of the humerus. To enable movement at the elbow joint, the ulna has a specialized structure, with bony prominences for muscle attachment. Important landmarks of the proximal ulna are the olecranon, coronoid process, trochlear notch, radial notch and the tuberosity of ulna. Olecranon, a large projection of bone that extends proximally, forming part of trochlear notch. It can be palpated as the tip of the elbow. The triceps brachii muscle attaches to its superior surface. Coronoid process, this ridge of bone projects outwards anteriorly, forming part of the trochlear notch. Trochlear notch, formed by the olecranon and coronoid process. It is wrench-shaped, and articulates with the trochlea of the humerus. Radial notch, located on the lateral surface of the trochlear notch, this area articulates with the head of the radius. Tuberosity of ulna, a roughening immediately distal to the coronoid process. It is where the brachialis muscle attaches. The ulnar shaft is triangular in shape, with three borders and three surfaces. As it moves distally, it decreases in width. The three surfaces. Anterior, site of attachment for the pronator quadratus muscle distally. Posterior, site of attachment for many muscles. Medial, unremarkable. The three borders. Posterior, palpable along the entire length of the forearm posteriorly. Interosseous, site of attachment for the interosseous membrane, which spans the distance between the two forearm bones. Anterior, unremarkable. The distal end of the ulna is much smaller in diameter than the proximal end. It is mostly unremarkable, terminating in a rounded head, with distal projection, the ulnar styloid process. The head articulates with the ulnar notch of the radius to form the distal radio-ulnar joint. Quiz: what area on the ulna articulates with the head of the radius? Trochlear notch. Radial notch. Ollcranon. Radial process. The correct answer is radial notch. The radius is a long bone in the forearm. It lies laterally and parallel to ulna, the second of the forearm bones. The radius pivots around the ulna to produce movement at the proximal and distal radio-ulnar joints. The radius articulates in 4 places. Elbow joint, partly formed by an articulation between the head of the radius and the capitulum of the humerus. Proximal radio-ulnar joint, an articulation between the radial head and the radial notch of the ulna. Wrist joint, an articulation between the distal end of the radius and the carpal bones. Distal radio-ulnar joint, an articulation between the ulnar notch and the head of the ulna. The proximal end of the radius has a head, neck and tuberosity. The radial shaft expands in diameter as it moves distally. Much like the ulna, it is triangular in shape, with 3 borders and 3 surfaces. In the middle of the lateral surface, there is a small roughening for the attachment of the pronator teres muscle. In the distal region, the radial shaft expands to form a rectangular end. The lateral side projects distally as the styloid process. In the medial surface, there is a concavity, called the ulnar notch, which articulates with the head of ulna, forming the distal radio-ulnar joint. The distal surface of the radius has 2 facets, for articulation with the scaphoid and lunate carpal bones. This makes up the wrist joint. Quiz: which of the following bones does the radius articulate with? Ulna, humerus, scaphoid, pisiform. The correct answer is pisiform. Bones of the hand. The bones of the hand provide support and flexibility to the soft tissues. They can be divided into 3 categories. Carpal bones, a set of 8 irregularly shaped bones. These are located in the wrist area. Metacarpals. There are 5 metacarpals, each one related to a digit. Phalanges, the bones of the fingers. Each finger has 3 phalanges, except for the thumb, which has 2. The carpal bones are a group of 8, irregularly shaped bones. They are organized into 2 rows, proximal and distal. Proximal rows from lateral to medial include scaphoid, lunate, triquetrum and pisiform. Distal row from lateral to medial include trapezium, trapezoid, capitate, hamate. Proximally, the scaphoid and lunate articulate with the radius to form the wrist joint, also known as the radiocarpal joint. In the distal row, all of the carpal bones articulate with the metacarpals. The metacarpal bones articulate proximally with the carpals, and distally with the proximal phalanges. They are numbered, and each associated with a digit, e.g. Metacarpal 1, thumb. The phalanges are the bones of the fingers. The thumb has a proximal and distal phalanx, while the rest of the digits have proximal, middle and distal phalanges. Quiz: which of the following is not located in the proximal rows of the carpal bones? Scaphoid, lunate, trapezium, pisiform. The correct answer is trapezium. Thanks for watching. Like and subscribe to Anatomy Movement channel for more.